Before you put your significant other in skilled nursing or in a rehab facility, one of the things that you should know is the likelihood for sexual assault goes up. Hi, my name is Dr. Natalie Jones. I'm a licensed therapist, and I've spoken to you all before about my experience in working in skilled nursing. But one of the little things, or one of the big things that people don't know about, like skilled nursing or even like assisted living facilities, convalescent homes, and things like that, is there's a lot of sexual activity that goes on behind closed doors, and not all of it is consensual. So one of the things that you should be wary of, particularly if you have um, a family member that is not coherent, is not able to verbalize, not able to physically ask for help. And I know that a lot of you feel like, hey, I can't assist my parents, or I can't assist my child. I can't do all the things for them. And so I'm trusting that a facility is going to take care of them. And this isn't meant to be derogatory towards all facilities, because certainly not all facilities have this, but there are a number of facilities where the workers, other patients, other people who've come inside the facility have been known to sexually assault the patients that are there, and unfortunately, risk for a lot of things increases when you have people that cannot advocate for themselves. So one of the things that I would encourage you to do, especially if this is someone that you care for and you visit. I think people that are well looked after, meaning that their family is always there, the risk goes down. But if you can't always be there, make sure that you have 24/7 access to that person's room, your family member, your loved one, so that you can always see. Like, they need to have cameras in their room, but even if it's in their room, you have to recognize it's not always in the living areas. You may be able to, that may be something that you also ask the facility for, kind of like how some daycares are set up now, to whereas like parents can always see their children at any time of the day. You may want to pick a facility where you can always see your person at any time of the day, wherever they're at in the facility. You're able to track their movements and so forth. When people are elderly or vulnerable, the risk for abuse goes up higher. And there's been, there's been news stories where, women have been in facilities and have been comatose, and have turned up pregnant, and they were in a coma for a year, or so, and they never came out of it, and somehow they mysteriously came up pregnant. So this kind of stuff happens. Don't ever think it can't be your family member, because it certainly can be, but you want to take the necessary precautions and steps. So there can be any number of things that also happens outside of sexual assault. One of the other things that also happens is, physical abuse, but also financial abuse. When it used to be a real big thing back when I worked at facilities, that other patients will break in other people's room and steal their money, because addiction can also run rampant. But just things can happen, and you always want to be sure about that. So I hope that helps. Thank you so much.